Good morning, everyone. My name is Ákos Mátrai, and I would like to give my presentation about my 3-month progress report of my PhD work at the Center of Translational Medicine. My research topic is the effects of maternal infectious disease and drug treatment during pregnancy on the fetus and on pregnancy outcomes. I work as a specialist at the Department of Obstetrics and Gynecology at the Semmelweis University. My supervisor is Professor Nándor Ács, and my vision is to provide optimal pregnancy care that contributes to the birth of healthy fetuses. That's why with my PhD work my mission is to highlight the risk of infectious disease during this during the pregnancy. First of all, I would like to show an overview about my two ongoing topics. First is meta-analysis and the systematic review and the meta-analysis, and the second will be a registry analysis. Let's begin with my first project, which is the meta-analysis. This is the investigation of the effects of maternal influenza during pregnancy on birth defect. A few words about the background. Flu is a very common infection. Every autumn and winter there are around 50 million illnesses worldwide, and according to the Central Statistical Office, in Hungary there are about 400 cases per year. We know that the birth prevalence of congenital malformations can be estimated at 3 to 5%, and these disorders underlie around 25% of perinatal mortality. The aim of our study is to assess the effects of maternal influenza during pregnancy on birth defect. The clinical question is, does the influenza during the pregnancy increase the number of congenital malformations? As on the slide you can see, we are investigating the presence and the absence of influenza during pregnancy, and the outcome is the non-chromosomal birth defect. Our hypothesis is influenza occurring in the first trimester increases the risk of congenital abnormalities. The clinical implication of these meta-analyses is to highlight the effect and the risk of influenza during pregnancy in this pandemic period. We made the systematic search in 3 databases in the end of October with the following search key. We also did the title and the abstract selection and also the full text selection, but now we are waiting for the library's help to search for a few articles which we didn't find. After that, we will start the data extraction. Let's move on to the second ongoing topic, which is registry analysis. This is the investigation of the effects of maternal influenza during pregnancy on birth defects in the Hungarian population between 1980 and 2009. As I mentioned before, the influenza is a very common disease that occurs during epidemic outbreaks between December and March. The non-chromosomal birth defects are 4.5% of live births in Hungary, and they cause 25% of perinatal mortality. Our aim with this registry analysis to assess the effects of maternal influenza during pregnancy on birth defects in the Hungarian population between this period. A few words about the database. This database is the Hungarian Case Control Surveillance and Congenital Abnormalities. It was established in 1980 and it is unique in the world. It contains around 90,000 data about the pregnancies. Our clinical question, the PICO and the hypothesis, is the same as I mentioned in the first project. And our clinical implication is to highlight the risk of influenza during pandemic periods in Hungary. On the next two slides, I would like to present a quick look to the most important data which we got after the analysis. First, we have verified that influenza in the first trimester is a risk factor for development of congenital malformations. After we examined what kind of birth defect can develop if the flu is presented in the first trimester. We divided them in three groups. This is neural tube defects, cleft lip, and cardiovascular malformations. Before my last slide, I would like to show you the progress of the registry analysis. We did the final statistical consultation, the data evaluation was adequate, and now we are now in the preparation of the article period. At the end of the presentation, let me summarize once again. We are investigating the effects of maternal influenza during pregnancy on birth defect with a meta-analysis and with a registry analysis. And I would like to close my presentation with a quote also from Steve Jobs. Sometimes when you innovate, you make mistakes. It's the best to admit them quickly and get on with improving your other innovation. Thank you for your attention.
Hi, Adam Széles from Department of Urology. My question is for the diagnosis of flu, how do you define in your meta-analysis or in your study the definition of flu? It's only PCR or the symptoms or both?
We defined it with symptoms. In the article, there are very clear symptoms, so fever, headache, and running noise. And we are doing the meta-analysis based on this.
Okay, thank you.
Thank you for your question.
Thank you. My name is Luca Hergar. Thank you for your presentation. And I wanted to ask you that how do you know that these malformations are clearly linked to influenza? Because the ones what you presented, like neural tube defects or cleft lip, if I'm correct, that these are quite common abnormalities. So how do you know that it's really caused by influenza?
Because we have a large database, we have a lot of data about it, and we did the statistical analysis, and we get these results. If we are doing with the logistical regression model, we get these results.
Okay, thank you.
I have a question as well regarding, of course, maternal influenza. So we talked about this several times, that fever is actually the cause of the abnormality. But actually, I'm really curious what you find during the search regarding the proper treatment of fever, if it decreases the chance or the proportion of malformations.
Thank you for your question. Yes. We also analyze the data based on the drugs, and if the flu is presented in the first trimester and the pregnant woman got antipyretics, anti-fever therapy, there were less congenital malformations. So we can decrease the development of the congenital malformations. We also with antipyretic and also with folic acid.
My question also relates to the first one, but in a different angle. That is there any way to, or is there any data on the different kind of violence of a flu, just like in COVID? I mean that the symptoms are very wide. I mean some are very severe, some others are not, and probably this, and neither there nor here, I think we know that what is really happening. I mean, that what is the mechanism of action. So is there any clue, any data, actually by kind of classification of influenza by severity, so you can actually also look at that, or no?
No, the fever is the most important thing in this case. If fever presented, we have a much higher risk for the congenital malformations. If fever not presented, just running nose or headache or something like that, we got less congenital malformations.
Actually, can you do subclasses of patients in your meta-analysis saying that the less severe cases have actually less risk or lower risk or this is just what you think?
Yes.
I mean, there were no subgroups in the analysis and the meta-analysis available whether the influenza was a severe one or a less severe one. There are no clear criteria to put the cases into severe or less severe, but Ákos has really very nice results, and therefore we know that the fever is the most important factor. So if the patients get a proper anti-fever therapy, the risk of the development of malformations is going back to normal levels.
Yeah, I think this is a very important study.
Thank you for your question.